Hello, my name is Jeremy Marut. I'm the Chief of Digital Modernization here at Tufts Medicine in Boston, Massachusetts. It's kind of fitting to tell our story here from Boston because we've declared independence from the data center and we've liberated the masses from the tyranny of the decades of technical debt that we as an industry have built and acquired over the years just to be able to survive. And I'm here to discuss the journey that we've taken to get our entire healthcare ecosystem out into the AWS cloud. And I guess I'll start with Tufts Medicine. We were known as Wellforce for a little while. We are a 3 hospital system in the Boston, Massachusetts area, consisting of Tufts Medicine, Tufts University Medical Center, Melrose Wakefield Hospitals, and Lowell General Hospital, as well as many numerous private practice clinicians and a home health organization. I'm honored to be here today and proud to share our story. It's one of the most truly real, actual transformational projects that I've been involved with in my 20 plus year career. I have a lot of firsts in the industry, specifically with Epic and with a lot of healthcare IT ecosystem. This one, however, is really going to shake the industry up and change us for the better for the future. And it's a big foundational step that we had to take in order to make these changes happen. We took this on as part of the core digital transformation journey here at Tufts. We began this journey about 4 years ago. We exhaustively evaluated all of the major cloud vendors out there. We stuck close to what we call our mothership, Epic, to find out what they were going to do with cloud and how they were progressing with cloud. And we made very deep relationships at the highest level at all of these organizations to find out what our pathway would be to get to cloud. We began our journey a couple of years ago and COVID hit and kind of derailed us. But we had the great fortune to be approached by Mr. Michael Dandorf, who's the CEO here at Tufts Medicine. He actually recruited my boss, our Chief Digital Officer, Dr. Shafiq Rob, to run digital transformation here at Tufts. And Dr. Rob brought me along so that we can continue our journey, because the first thing in that journey was going to be a consolidated electronic health record, which is Epic. And we wanted to be able to implement Epic in the public cloud. And we chose AWS for very many good reasons. 20 minutes, by the way, is not enough for me to talk about this situation. So you guys will be able to reach out to me via email, Twitter, whatever, whenever you need, because I'm here to help all of you take the football and take it past the goal line and do whatever you can with this thing, because we're going to open up innovation now for healthcare by doing these foundational steps. Why did we do it? In the words of our CEO, Mike Dandorf, there's 4 million ways, 4 million reasons why we did this. And those are the lives that we serve on a daily basis, as well as over 18,000 providers, employees, people involved in this experience on a day-to-day basis. And our guiding principles are based on experience, creating a frictionless experience. And this opportunity allowed us to align our vision of not just doing another proof of concept or dipping our toe in and saying, hey, is cloud an option? This is 2022. It was 2021 when we signed, and everyone around us has been doing cloud proof of concepts for years upon years upon years. And now was the time where Epic actually came around. The compute, the processing, the memory from AWS was all up to snuff to be able to handle our size implementation. And we said, this is the way we're going, with Epic there along the way. And maybe more importantly, the entire ecosystem. So everyone has the EHR, the center of their world, but the actual experience at any organization is made up of what we determine to be about 40 mission critical, life critical third-party integrations. And we didn't want to have a hybrid, right? Well, our goal is to get out of the data center entirely. I know that's a lot of your goal out there. We wanted to move Epic and all those critical integrations into the cloud so that they can all take advantage of the same levels of high availability, the same levels of business continuity, and the same modern technologies available to us in 2022 to get us out of the 90s. Setting the scene a little bit, 3 disparate hospitals, actually with HHS, our Home Health Foundation. We've got a 4th. Every single one of them was completely independent from an IT perspective. We've got 3 or 4 of every different application out there. We've got a portfolio of over 800 applications. There were 6 EMRs, no joke, over 100 different patient portals, about 18,000 users, 1,000 beds throughout the system. And while we were pioneers and innovators for a very long time, like I said earlier when I opened up, this is probably the biggest one and will have the biggest impact to us completely. So in the end, right now, we've been live for about 6 weeks entirely on our Epic, brand new Epic implementation, as well as a migration and some new implementations of over 40 third-party integrations into Epic. When we set out on this journey and we said 40, I thought maybe we'd get 4 of them, but that list grew and grew, and we were actually successful on every single one of these applications. It was a very, very hard, arduous process to convince these companies to come over, but what we found is that everybody wanted that opportunity and a reason to move, and we finally gave it to them. So this cloud center of excellence that a lot of your organizations have, we're actually doing that excellence. We are doing these things, and we're based on relationships within the organization, but also, and maybe more importantly, very tight relationships with our technology partners. We're a true collaboratory. So we want to bring people in. We want to show you it's possible. We want to help upskill that staff. And we want to alleviate the worries that, oh my gosh, our software isn't cloud-based. We don't have any people that know anything about AWS. How's this going to happen? Don't worry. Come on board at Tufts. We're going to help you get there. And we've done that for over 42 different applications, at least 30 vendors plus, and it's been a fantastic journey. I fancy myself kind of the translator because I've got a very visionary chief digital officer, very progressive and advanced leadership, very fortunate to be here, that everybody's behind us on this journey to cloud. I got to take that vision that everything is on all the time, we're never going to go down, and kind of bring that to not only reality, but the reality of healthcare IT. And everybody who's in healthcare IT, I'm being very, very generous that our technology is maybe in the early 90s. Maybe. I mean, when we're talking fax and FTP, we're going way into the 80s and 70s. And these are vendors that are not your mom and pops. These are your big boys out there that are just not having that any reason to advance. Epic's been seriously exploring public cloud for very many years. They are on a journey. They are by far not a SaaS product. So in general, our Epic implementation is really a infrastructure as a service implementation. But with that said, AWS allowed us to be able to take a lot of their modern services and apply them to a more monolithic product and still get advantages out of it, and big advantages, from cost to supportability to full operation. We've developed many levels of automation to help in our Epic support, make it more manageable, make it more precise, make it more efficient to operate. We saved our go live, in fact, at least 3 times. We found a new system under every other rock that we opened up, and we had to bring in more data. We had to set up new environments. And instead of having to go and find hardware somewhere or find storage to be able to bring something up and take weeks to do that, within a matter of less than an hour, we're able to stand up a brand new environment. We're able to crank up the oomph, behind any of our environments as needed. When we have massive loads that would normally take weeks upon weeks, we've cranked up our SQL servers for some of our conversions, and we're actually gone from weeks down to just a couple days to be able to process this stuff. We use CloudFormation templates. We've defined all of our infrastructure as code. In today's world in healthcare, there is nobody, hardly on roadmap, that has full infrastructure as code. Our entire ecosystem is all infrastructure as code. So for us to go and turn around and bring up another hospital, another environment, another system is literally a matter of hours as opposed to days, weeks, and months. We use Control Tower and CloudWatch to do a lot of the automation around alerting and monitoring. We've built a AI ops practice where we take the telemetry from all of these applications in the entire ecosystem. We've built canaries to go and actually test that things are working. And more importantly, when things aren't working, not only are we alerting ourselves earlier, we're auto healing and auto fixing a lot of things. And that's very scary. It's very scary for anybody getting into this to say, oh, it's going to automatically heal itself. But we've gone through that pain, and we've also been able to make things a lot more safe and secure by using these tools. The significant savings that we realized by moving from physical infrastructure out to AWS, a lot of that, probably around 30% savings we found. A lot of that we've reinvested back into our business continuity and high availability setup. We are currently set up for all of our applications, the entire ecosystem, across 2 independent AWS regions with 3 independent availability zones per region. Now, that's not to say our vendors, most of them aren't capable to run like this yet, but our golden architecture calls for it across those so that when we do finally get to a place that's modern in terms of technology, we have an architecture that is highly available at all times, self-healing, and available to come up whenever we need. Again, I say we're very fortunate to be doing this here at Tufts. The leadership from the CEO to the board on down is completely aligned. This digital transformation, as my boss likes to call it, is our true north. And this project has been a great unifier, both in technology and people. As I said, we had completely diverse independent IT departments across these different hospitals, 4 different, maybe more data centers, all sorts of flavors of applications. And this gave us the opportunity to bring it all together. We added another domain, but we all figured out how to get all those trusts together, use a universal way so that everybody logs in exactly the same way, and the experience is equalized across the organization. And as I said, the cloud is foundational to our transformation. It's not like, oh, we moved our infrastructure to the cloud and now we're like some kind of advanced institution. It's still infrastructure, but it allows us to really democratize innovation and now open our teams up and our people up to actually do things that will change something in healthcare, as opposed to making sure I'm keeping my hardware refreshed, or the server's not going down, or I'm patching this and that. It really opens up your skilled ninjas to be IT ninjas, as opposed to keeping lights on and figuring out that the data center is going to be okay. Our main core goal is to bring joy back into the lives of our clinicians and our providers and anybody who interacts with our patients along the way. Our entire project was complete in just 14 months, and I was pretty overly excited. I was the team. The Cloud Center of Excellence consisted of Jeremy and Marut. Yes, that was just me. When we signed on the line in November, I believe, of 20, Epic wasn't even ready to say, yeah, we're good with AWS, until we were able to show some performance numbers, and then we got their support. By February 8th, I had a crack team of the core Epic certified individuals that I needed to set up our non-production environments. And Amazon really came through, and one of the reasons we selected them with the professional services group, shout out to Kevin Vaughn, he's the man, where we stood up our non-prod environment in under 10 days. It was all codified into CloudFormation templates to the point that our production environment build took us a matter of days. I mean, we had some tweaking in there for a lot of the Epic web shared services, but for the most part, the actual servers and the whole environment was up in probably about a day. And some of the bigger lessons that we learned, and this time is flying by, our vendors, our technology partners, they are really our partners. I can sit here and bash people all day. But the fact of the matter is that there's been no incentive to get out of the 90s. There's been no incentive to do cloud. There's been no incentive to actually modernize because the big players in the game aren't addressing it right now. And it's not a priority. So when we went to 100% of our partners, the number one thing that comes out of their mouths is no one has ever asked for this, and we're not going to be able to support you. We can't do it. So I wish I had known way early on to build this golden architecture well ahead of time so that you have some leverage. Going and doing it after the fact is a lot harder, but like I said, we were successful across the board. And the secret here is none of them will fit that golden architecture. Not Epic, not GE, not Philips, nobody. But you want to have a baseline and you want to have a goal to what you're going to reach and how your environment is going to look. And we're going to flip the script. We've already done it. For years and years and years, you're spending millions upon millions on a piece of software. And that software vendor is coming to you and saying, this is how you have to run us. This is the environment you need to give us. We're not going to work on anything else. We're flipping it and saying, we like your software. We'd really like to purchase it. But in order for us to purchase it and you to operate here, you have to follow this architecture. You have to be able to support this level of availability and business continuity. And what that allowed us to do, like I said, nobody's ready yet, is to prepare the operations for, hey, Epic might be up within 30 minutes, but your pharmacy system may not be up for 4 hours. So at least you have transparency across the organization. No one is ready with TLS security. That's a huge issue moving into the cloud. We worked with Amazon to really work on the BAA and the infrastructure. Everybody points to, okay, we've always used VPN. VPN significantly limits your throughput, significantly increases your latency, and is just not good for high availability, business continuity across zones and regions. And that's something that we could deeply get into if you want to reach out to me later. And then the training and innovation. And like I said earlier, freeing people to become innovative and do cool stuff that's going to change things. Go find your cache administrator and tell them you're going to get them out of the green screens and checking boxes off a list and actually doing cool stuff. They're going to light up. The morale is through the roof, and we are ready to take this on into the next level. And I'm getting goosebumps just talking about this. I wish I had more time to talk about this with you guys. So we've achieved all the hard ROI, like I said, a little over 30% in savings, but the soft ROI in what I call competitive advantage, when you look that up to become rapid, agile, and unified, I think one of the definitions would be the only ones doing it. And we are currently, we won't be for long. And I'm glad for that because we did something to change things. And I hope to empower you all to go out and do this. It's been a phenomenal ride. We're all in the business of saving lives, every single one of us. We're not here to run data centers, and AWS and the cloud free us from the rote, commodity, mundane work that we've been used to. Freeing up funds and minds to actually change healthcare for the better, for every one of us, for all of our families, and for humanity in general. So I thank you for coming together. If you want to talk to me at any time, you could tell I got a lot to say. So good luck on your journey, and I hope you're successful. Thank you very much.